Okay, Dr. Wade is in the house. Welcome back. Hadn't seen you in quite a while. You're as lovely as usual.
Well, thank you.
And I think somebody was calling you the world's best dentist.
Well, I don't know about that, but I think I'm pretty good.
Yeah, you've done some work for me in the past. I'm Michael Harris, by the way. We're in the mix. And Dr. Wade with her lovely self. And she can make your smile as lovely as hers. For people who don't know you, would you give us a little bit of introduction?
Absolutely. Okay, my name is Dr. Karan Wade, and my office is located at 2101 Crawford. We're right on the corner of Crawford and Webster, Crawford and Gray, right across the street from St. John's Church. And I can be reached at 713-654-7756. The office number, again, is 713-654-7756, and we can take care of all of your dental needs.
All of your needs?
All of your dental needs.
Okay, all of your dental needs. Okay, give us a little bit of your history.
Okay, well, I've been practicing dentistry for over 13 years. I went to the University of Texas, is where I got my degree in dentistry. I went to the LVI Institute in Las Vegas, is where I got my cosmetic training. I did my undergraduate studies at Wiley College and Texas Women's University.
You went to TWU?
I went to TWU.
And Wiley and Marshall?
In Marshall, Texas.
Good
I have
Lord.
a degree in biology from Wiley College in Marshall, Texas, and I have a nursing degree, a BSN from Texas Women's University. I didn't know what I wanted to be when I grew up.
And are you a native Houstonian?
I am not a native Houstonian. I grew up in New Jersey, and I just migrated to Texas to go to school when I went to Wiley College and got to Wiley and decided to come to Houston and made this my home. So I'm a transplant Houstonian.
Well, hey, New Jersey's not a bad place.
No, it's not a bad place. Too cold for me, though.
I can dig that.
Too cold.
And so how did you get your interest in dentistry?
Well, I've always had an interest in dentistry. Even when I was a registered nurse, I had an interest in dentistry. And so after practicing nursing for about 6 years, I decided, you know what, I'm going to follow my heart's passion and go back to dental school. So I went to the University of Texas, and, teeth and dentistry have just always been in my heart, in my life, and it's what I wanted to do. So now I'm just like as happy as I could possibly be because I love what I do. Wow.
Now, if you were older, you might have been a part of my history. The first time I went to a dentist was at the UT school over in the medical center because I didn't have one.
Right.
And I had a problem and I didn't have any money. And someone said, hey, you can get it done. I don't know if it was very cheap or for free.
Yeah, well, usually over at UT, you see students, but there's an instructor that's facilitating them, and you can get your dental work done for pretty cheap rates. Right now, I think what you're paying for are any of the materials that they use. So you can go over there and get some work done if you don't have dentists, don't have insurance, or you just need to be seen. They have emergency clinics, I know, early in the mornings, but you have to call the school to find out that information. But I know that they did have those facilities or those services for the community.
You could have been my first dentist if the timing had been right, but I think I'm a little older than you.
Maybe a little bit.
But you do have lovely offices, beautiful offices, well-staffed offices. In fact, it seems like you want to be one of those cutting-edge dentists. If anything new comes out, Dr. Wade wants to do it.
Well, I try to stay abreast of all the new techniques that are coming out, the new literature that's being taught by, or they're coming into fruition about, like periodontal disease, like the things that cause periodontal disease. They have more information about that and the problems that periodontal disease can cause. There's a direct correlation between periodontal disease and heart disease, people having strokes, heart problems, things like that, because the same bacteria that's in your mouth, that's in your gums, that causes periodontal disease can get into your bloodstream and cause you issues also. A lot of people don't realize that there is a direct correlation. They just think your teeth are something that you eat with, and something, if you have a problem with them, you take them out, but that's not really true at all.
Okay. Well, what really surprised me was that there was a relationship between gum disease and heart disease, and that's really...
It's from the inflammation that's in your gums. That bacteria can get in your bloodstream and cause you problems with your heart, and because that bacteria can travel to your heart and cause you to have problems.
Wow. And there are just so many things. Well, one problem that I have is I've gotten older. It seems like my teeth have gotten wider. They don't seem to be as tight as they used to.
Well, what happens as we get older, as we all get older, we start to lose bone. And so that could be one reason that your teeth are maybe not as tight as they used to be. If you've lost teeth in the past, your teeth actually start to shift because your teeth are alive, okay? They're not just not just sitting there in the gums. They're actually connected to the bone and your bloodstreams and nerves. So what happens is when you lose teeth, your teeth actually start to shift, and your teeth like to touch side to side, and they like to touch up and down. So when you lose teeth or you have teeth that are missing, your teeth will start drifting in one direction or the other because they're trying to find a contact. So that's what causes your teeth to kind of like start getting spaces, or your contacts not as tight as they used to be.
Well, thank God I still have all of them. The only ones I had taken out were my wisdom, but still I find stuff getting trapped between them.
You're probably losing some bone in what they call interproximal, in between your teeth. You're probably losing some bone there. And like I said, as we get older, we all lose bone. So you might want to just get that checked out to see how much bone loss you have. Can bone be regenerated? Not actually, but you can cause the bone to stop. So you can cause yourself to stop losing bone with regular cleanings and things
with regular
like that.
cleanings.
Yeah, right.
Yeah, because what I find out is that if something's trapped in there and you don't realize it, all of a sudden I'll start feeling like,
like you have a toothache.
Yeah.
Absolutely.
And then the stuff, when you get it out, it's foul.
It is, because we all have bacteria in our mouth. And what happens is that there are little ligaments that actually attach the gum to the teeth. And what happens if you get something trapped in between your teeth, it'll irritate that gum tissue down there. And sometimes I feel like you have a toothache, and it's actually not really a toothache. It's just that you have irritated those ligaments that actually attach the gum to the teeth. And it'll cause you discomfort, like as if you have a toothache, as if you have a cavity or something like that. And it's actually just because you have something stuck in between your teeth. But those spaces can be corrected with braces and things.
Okay.
You're never too old to get your teeth. Never too old to get braces. But you might want to get that checked out. If you're finding that you're having spaces, and because you might be losing a lot of bone, and it might just be something that probably can't reverse it, but it can be halted. Yes.
And do you still do the special whitening that?
We're still doing the special. We're actually doing two specials. We're doing the cleaning special right now for patients who don't have dental insurance. If for $99 you can get an examination, x-rays, and a cleaning. That's a regular traditional cleaning, and you can come in and get that done at the office, and we're running that special. We're also running a take-home bleaching special for $150. Yeah.
And what about that bleaching that you did for me? It was
the in-office bleaching?
Yeah, it was with a laser, it seemed.
That's it wasn't really a laser. It was an ultraviolet light. And what happens is that when you bleach your teeth, you actually when you do an in-office bleaching, you just kind of like paint the gel on your teeth. And what happens? The light activates the gel, and it actually gets down into the dental tubules. Just like we have pores on our skin, you got dental tubules in your teeth, and the gel gets down in there, and it lightens your teeth up.
And how often can you have those?
It's recommended maybe about once a year. If you do it too much, you can develop sensitivity, because anytime you bleach your teeth, you can develop some sensitivity. That's normal.
All right, Dr. Karan, that's K-A.
-R-O-N.
Yeah, I was going to say dash. Y Wade from New Jersey. She's in the house, and she has her dental practice. It is just named after you?
It's just named after me. We also have a secondary name, which is called Cosmetic Dental Texas. That's our stage name, so to speak. But we're located at 2101 Crawford, right there on the corner of Crawford and Webster, Crawford and Gray, right across the street from St. John's Church.
And she's changing the world one smile at a time. Her telephone number is 713-654-7756. She's going to be coming in and visiting with us every other Tuesday from 11:30 until 12 o'clock. And so if you have any dental questions or know someone who has questions that they need answering, and if they're looking for a dentist, don't forget to tell them to tune in every other Tuesday from 11:30 until 12.
And if anyone has any questions specifically about any dental problems that they might be having, I'm sure they can call the station, and you can give them that number, because I don't know that number by heart.
Well, I'm giving it right now. 713-526-1230, 713-526-1230. And we have some people who have called, and I assume they have a dental question for you, okay? All right. Hello, caller. You're on with Dr. Karan Wade.
Good morning, Michael. Good morning to you, guest.
Good morning.
I have a question concerning, I got a partial plate. It has cracked. I've been keeping it together with this dental glue. I went to see what it would cost to have it fixed, and I couldn't afford it. I just retired, by the way, so I'm on a fixed income. So I'm interested in that place where you said that you could get some help there at a reasonable price.
Well, over at the dental school, I'm not sure if they actually do repairs because those are students that are doing the work over there. But it never hurts to try or give them a call. I'm not sure, like I said, if they actually do repairs. I know that they make partials and they make dentures and things like that. But I don't know about doing repairs. But you can always call the University of Texas. I'm not sure of the one number, but you can call information. They'll gladly give it to you. And you can see if they actually repair dentures. Because you have to be selected by the patients. The patients that the students need for credit, they select patients who for the procedures that they need for credit.
Right. Well,
okay.
I understand that.
No, can she possibly help you, caller?
I beg your pardon?
Can she possibly help you? Maybe she might have something that would work for you.
Yeah, and you can always call the office at 713-654-7756. You can come in for a free consult. We do free consults, and let me take a look at your partial and see what we can do. And, we have reasonable rates, and we also have payment plans. You can have that worked out with the office manager, so you can just give us a call at the office and come in for a free consult, and we can tell you what we can and cannot do.
Well, I do have some dental insurance, but I just don't know how good it is. I tried using it once before, but since I've been retired, it's kind of... put another obstacle there. I got 713-654. What was the last four?
7756.
Okay.
All right.
All right. And there's one last question.
Yes, sir.
New Jersey. What city in New Jersey?
Jersey City.
Okay.
All right.
I'm from New Jersey, too. So
okay.
That's why I wanted to ask.
All right, then. It was a pleasure speaking with you.
Thank you, ma'am. Bye-bye.
All right. The only place I've been in New Jersey is basically to Atlantic City and those surrounding areas. And then I had a friend who lived in Fort Lee, which is right across.
What is that, right across the water someplace?
Yeah, in fact, you go through a tunnel.
Holland Tunnel?
I don't know if it's Holland Tunnel. It's been a long time since I've been there. And in fact, she moved somewhere else years ago.
Oh, okay,
Yeah,
okay. Well, the Holland Tunnel connects New Jersey and New York together. And you go
so
up under the Hudson, under the Hudson River. I don't like that place. I just get the creeps when I go up in there. I keep thinking the walls are going to cave in or something.
Okay, well, that was the tunnel in order to get to Fort Lee.
Right. The Holland Tunnel and Lincoln Tunnel, they have two of them. I think it depends on what side you come in with, which name they're using.
Okay.
Yeah.
713-526-1230 is the number. Dr. Karan Wade, a dentist, is in the house. And if there's anything dental, she has an answer for you or a referral for you. Okay. Hello, Cassandra.
Yes, hello. I was calling to see, are you a pain-free dentist?
Well, I'm going to be truthful. I don't think any dentist is totally pain-free, but I have a gentle hand. In my former life, I was a registered nurse, and I was a pediatric nurse, so I have a very good chair-side manner. I usually numb my patients up with some topical gel or some spray to kind of like freeze their gums, so in case they need a shot, they really don't feel the shot. You might feel the medicine going a little bit. It might feel, you might have a little sting, but to be honest with you, 100% pain-free, I don't know. I don't think so. I don't think anyone can make that claim. I'm sure I've heard those claims, but they're not being totally honest.
I've made my appointment with the office. But what I want to know, if you take blood thinners or aspirins before you have any dental work done, should you be off them for a certain period of time?
Okay. That's a great question. Usually patients are having teeth extracted, any teeth that are being removed, you want to be off your blood thinners or for a certain period of time. Some doctors, you have to check with your medical doctor, but some of your medical doctors want you to be off 24, some of them 48 hours, and some of them even up to 72 hours. So you will have to check with your medical doctor. But for any other treatment, such as a filling, a cleaning, or anything like that, you don't have to be off your blood thinners.
Okay, well, thank you.
You're very welcome. Thank you for calling.
All right, 713-526-1230. What are your office hours the days that you work?
Okay, well, we're at the office, seems like every day, but we're there Monday through Thursday from 7:30 a.m. until 6 p.m. and on the first and second Saturday from 7:30 a.m. until 3 p.m. So we have those Saturdays appointments for patients who work during the week and can't come and see us during the, during the regular work week. So we're there, like I said, again, from 7:30 until about 6.
7:30 until about 6. And, well, I'll ask another question after we take another caller. 713-526-1230 is the number. Dr. Karan Wade in the mix here on 1230 a.m. KCOH Houston, and that caller dropped. What is the process for becoming a client? And what insurances do you or don't
Okay,
you
well,
take?
we basically take all insurances that are PPOs. We take some of the Medicaid insurances for adults and children. We also see children. You just need to call the office because Medicaid has so many different plans, and some of the plans we're on and some of them we're not on. So you would just need to call the office and find out. But as far as commercial insurances are concerned, if you have any type of indemnity insurance, meaning you can go anywhere you want to go, or if you have what they call a PPO, you can come to our office. But if you have the DMO or DHMO, those are types of insurances where you have to be that the doctor have to be specifically on that plan. And I'm not on any of the DMOs or DHMOs. But like I said, we have very reasonable rates. We have, those specials for patients who don't have cleanings at $99 special for examination, x-rays, and a cleaning. And we have we try to work with our patients, making sure that if they don't have the funds to pay for their procedures right then, that we'll work out some type of payment arrangements. And, we can go from there. But you just need to come into the office and make an appointment. And like I said, we have free consults also. So you can come in. If you're not really sure what's going on, we'll do a free consult, let you know what you got going on, and we'll go from there.
Okay. AJ is up next. You're on with Dr. Karan Wade. AJ, good morning.
Hello?
Dr. Wade, how are you?
I'm doing just fine. How are you doing today?
I'm doing pretty good. Guys, I got kind of a so-so phone line here, so I'm going to leave questions with you, doctor, and I'm going to listen to you on the radio.
Okay.
First question. In a tooth that the nerve has died and the tooth is darkened, can you whiten that tooth? And the second question is sort of a state-of-the-art question. Have you heard anything about them using stem cells to regrow teeth?
Okay.
And I will leave those two questions, which now listen to you on the radio.
Okay. So I'll answer your second question first. Yes, I have heard about them using stem cells to regrow teeth. It's still in the investigational stages. It has not been passed on to us regular dentists in the world. They're still investigating and doing a lot of research. So I hope that answered your question. Hopefully in the near future, all of us will be able to use the stem cells to help patients regrow teeth. So, like I said, that's still an investigational stage, still in, they're doing a lot of research on that. But it's in the near future, so hopefully it'll come to pass pretty soon. As far as your first question is concerned, when you were asking about if you had a tooth that turned dark because the nerve was exposed, I believe that was the question. Usually when a tooth turns dark, it is usually because the nerve has died. Either it was damaged, or either you hit the tooth or the tooth broke and the nerve actually just died and the tooth will discolor. What happens is, can it be lightened up? Sometimes it can and sometimes it can't. It just depends. It usually just depends on the circumstances of the reason why it's turned dark. So like I said, you would really have to come in the office and let me take a look at it. We do free consults, like I said. You can just come in and let us take a look at it. We can kind of basically go from there. And I'll give you the office phone number again. It's 713-654-7756. And like I said, we are at 2101 Crawford on the corner of Crawford and Webster, Crawford and Gray, right across the street from St. John's Church.
Now, what do most of us need most often?
Most of us need most often is to go see your dentist every 6 months, because most of the time there are so many people, they never come to see the dentist until they have a problem, unless they have a toothache, unless they're in pain. And I have patients that come in all the time. It's like, when is the last time you've been to the dentist? And they'll say, I haven't been to the dentist in like 5 years, 6 years, 7 years. And that was the last time they had to get a tooth extracted. So actually, you're supposed to see a dentist every 6 months for, your basic oral hygiene, to make sure that everything's looks good, that your mouth is healthy, and to identify any problems that you might have or the dentist might identify that you could have in the future. So that's why it's most important that you see your dentist every 6 months. And also, a lot of people don't know that especially people who smoke, you're very prone to having developing oral cancer, and oral cancer is a very devastating disease. And the thing is that if it's caught early, it can be treated, and it won't be as devastating to the patient and disfiguring to the patient if they have taken care of that early on. So that's another reason why you need to see your dentist every 6 months. Get your basic exams, x-rays, and cleaning, and we do free cancer screenings when you come in for your exam. So, like I said, there are so many reasons why you need to see your dentist, and people just think you only go to dentist when you have a toothache, and that's really not true.
It's really not true.
It's really not true.
Something that you need to take care of on a continual basis.
Exactly.
713-526-1230 is the number. Dr. Karan Wade is in the house. Hello, caller.
Good morning.
Good morning.
Dr. Wade. Michael. Yes, ma'am. My problem is I had all my teeth removed because I had a bone marrow problem. I have no teeth. I haven't had any teeth for about 2 years now.
Okay.
And I have no insurance. I was wondering if there's a type of program that you have available.
Okay, like I said, we do have payment plans that are at the office. You would just need to come in for your free consult, and you can meet with the office manager, and she can tell you what options you have and what kind of payment plan arrangements that we can make for you.
Okay.
Okay.
Oh, okay, then. Thank you very much.
You're very welcome. Thank you.
Bye-bye.
Okay. All right, 713-526-1230. Now, one thing about our teeth, everybody wants good teeth, and we don't pay the price for them. But now they're saying that we can get those, what are the
little
things?
snap-on smile.
The snap-on smile.
Everybody wants those Hollywood smile. What the snap-on smile is it's kind of like a partial, so to speak. And if you have like space in your teeth, or you're just not really happy with your teeth, whether it's the color, the shape, or the size, and you say, I wish I had this movie star smile, but it's out of my budget. Mm-hmm. They have what they call a snap-on smile. And what a snap-on smile is that what we do is take an impression of your current teeth, and we send that to the lab, and the lab will actually make you some teeth that actually fit over your natural teeth. We don't have to remove any of your teeth or anything like that, unless they're loose or something like that. But it'll snap right onto your teeth. They look very natural. I have tons and tons of patients who have the snap-on smile, and they actually really like them because, if they have events or things that they need to do, and they want to go out into the community or, to events, that they family affairs and things like that, and they want to have a beautiful smile, we'll make them a snap-on smile, and it's very inexpensive compared to like veneers or something like that, where, this type of products that the movie stars have, but you can have a movie star smile at really a quarter of the price.
Yeah, because I know people like Denzel have really made some amazing changes. And I see, who else was that? There was another guy who I used to watch. He had a big gap, and then the next thing you know,
his gap was gone.
His gap was gone.
Well, as long as I've been seeing Denzel, he's had those veneers on his teeth, but I saw an old picture of him one time, I guess before he became famous, where he had that great big gap in his teeth. So he definitely has veneers on his teeth. And you can see, at least I can notice, like over the years when he's had them changed, I guess he upgraded to a later model, so to speak. And you can tell, and they look very, very nice, but he's had some work done. And so have, I would say, 99% of every Hollywood star that's out there, they've had work done on their teeth.
So what does stuff like that typically run? Oh,
well, for veneers, in my office, they run about $1,500 per tooth.
What?
Yes, sir. They're very expensive, very expensive. Most patients that I do a lot of cosmetic cases. Most of my patients, they'll get just like 6 across the front, the teeth that are actually in your smile line. So you don't really, they don't get them, on all of their teeth. They usually get them just in their smile line, so you don't know what's going on in the back of their mouth. Yeah.
So what do you do to? I just thought you just put something over them. Now, $1,500, it must be a lot more than that.
No, well, what happens is you have to actually cut the natural tooth down, cut it back some, because if you kind of think about it. You can't just take a crown or a veneer and put it on top of your natural tooth because it'll look too big. It'll kind of look like a chiclet in your mouth. So what we do is actually cut the teeth back, cut them down. We'll take an impression, send that impression to the lab, and the lab will fabricate a veneer. And a veneer is for each individual tooth, and they'll make them to custom size, custom shape, custom color, and they look just like your natural teeth. And I guess only your dentist knows for sure.
And so you file away my original?
You have to file down the natural teeth. There are some products out there called luminaires where they advertise that you don't have to cut the teeth back. But the thing is that I've seen those, and I have done a case, but it makes the teeth look so big. It looks like, they look like you have chiclets on your teeth. Mm-hmm. So I don't do the luminaires. I actually do the veneers where you actually have to cut the teeth back.
Okay. About $1,500 a piece.
Okay, well, when you win the lottery, you can just come on down.
I was going to say, it's going to take something like that or an amazing blessing. Of course, making big money like Denzel.
It's no problem for him.
And insurance, of course, doesn't.
Well, it just really depends. Now, if you have like a tooth that's broke, the insurance will pay for that if you needed a veneer. They usually pay about 50% of it. And usually the fee for the veneers, it is what it is, but the insurance company will pay a maximum of whatever your insurance pays. Like just say, for example, your insurance only pays a maximum of $600 for crowns or veneers. They'll only pay the maximum of the $600, and then you just have to pay the difference. Yeah.
Wow.
Yeah.
Okay, well, we're down to the last few minutes, and it is always a pleasure. Dr. Wade used to come in with Big Bill, on occasion. And I'm trying to remember, you had that fancy car. And
I still have my car. It's just raining outside. I didn't want to get it wet.
Oh, okay. And then she's riding in her Jeep today.
Oh, I'm driving my son's Jeep today.
Oh.
He hurt his knee, so he can't drive. So I figured I'd drive his car out in the rain.
Okay. But so you all, if you don't remember, just think about, Mr. Russell and his dentist, and you'll know that is Dr. Wade. And you see her face
he's
all
got a
over
beautiful
the place.
smile. So, I'm his dentist. So if you like his smile, I can create a smile for you just like that. I'm going to give you the office number one more time of 713-654-7756.
You want to give us the office location?
The office address is 2101 Crawford. We're right on the corner of Crawford and Webster, Crawford and Gray, right across the street from St. John's Church.
Now, if I'm a new patient and I'll make an appointment,
you call the office. If you're a new patient, call the office, make an appointment. We also do walk-ins. If you don't mind waiting, we'll take care of if you want to do a walk-in. But like I said, just call the office, make an appointment. And I would like the whole listening audience to take advantage of that $99 special that we have going on for the examination, x-rays, and the cleaning.
the whole audience.
Exactly.
All right. And how long does that take? Do you have to make an appointment?
You just need to call and make an appointment. Like I said, we do have walk-ins, so if you don't mind waiting, we'll take care of you if you don't mind waiting if you don't have an appointment.
Now, what do you get with that?
An examination, x-rays, and a cleaning.
Examination,
x-rays, and a cleaning. Right. And we can let you know everything that's going on in your mouth.
And what if I wanted to run a whitening with that?
If you want to do a whitening, well, you know something? If you call today for your appointment, I'll throw in a take-home bleaching, a take-home whitening kit.
Okay.
All right.
All right. Anything else?
That's about it.
Well, it is a pleasure seeing you. Let's see. Been trying to read what your shirt says.
Changing the world one smile at a time. That's what I do.
Number one dentist?
What does it say? My patient gave me this shirt. It says, what
number
does it
one
say?
dentist.
Changing the world one smile at a time. Number one dentist.
That's Dr. Karan Wade. Okay.
Exactly.
And we'll see you in a couple of weeks.
We'll see you in a couple of weeks. It's a pleasure, Michael.
Well, it is a pleasure, Dr. Wade. All right. This is